Good day, our listeners. Today we have another wonderful guest joining us, Dr. Kristi Vaughan, all the way from Costa Mesa, California. We're going to have a frank conversation with her. She's a chiropractor and certified functional medicine doctor. So, Dr. Kristi, if I may call you,
yes,
please give us an introduction and we go from there.
Hi, everyone. I'm Dr. Kristi Vaughan, and thank you so much, Dr. Cave, for having me on today, and hope everyone is interested in the subjects today. I know he brings a lot of information, so thank you. I am a doctor of chiropractor, and I specialize in functional medicine. My story is really long, so I'll make it short and sweet. I got introduced to holistic medicine in my 20s. The doctor saved me from having my tonsils taken out. After that, I was so intrigued. I started following him, working with patients, changing my whole degree and going back to school. And today I apply everything I learned from him and more. I specialize in functional medicine, applied kinesiology, nutrition. And before school, I knew that's how I wanted to approach health and wellness, was inside out and helping people learn what real health is about. So I'm excited today, and thank you for having me.
Thank you for being with us. Okay, let's start right off the bat. This time of the year, as you know, stress is one of the things that lots of our patients, our family members, ourselves deal with. What are the effects of stress physiologically in our body?
Yeah, thank you. So stress has a numerous amount of effects. It raises cytokines, which is inflammatory pathways. And once the cytokines and inflammatory pathways are upregulated, it can take time to downregulate those inflammatory systems within the body. And it's a systemic upregulation, so it doesn't just affect one organ or one system, it affects the whole body. And so stress upregulates cytokines, inflammatory pathways. Obviously, it is an emotional stressor. So, the best way to be at peace is, be like Gandhi and try not to stress about things. I know that can be challenging, even for me. I like to implement meditation and yoga. I joke around and say when I'm in yoga and come out, I love my life, and a couple of days later, I'm needing another dose of it. So I think stress is one of the number one effects of diseases.
Perfect. Now, unfortunately, or should I say fortunately, wellness is an ongoing lifestyle. You can't just go to a gym one time and say, okay, now I'm fit.
Yeah.
Or you can't just brush once and say, okay, my teeth are good for the rest of my life.
Yeah.
So lifestyle is something that we have to do. And with regards to stress, management of it goes a long way. Now, I know one of the side effects of stress could be a way that the body acts as to, it's like autoimmune disorder. It causes autoimmune disorder. And one of the side effects could be thyroid dysfunction or dysfunction. Can you get into details with regards to thyroid dysfunction?
That is one of my favorite topics. Yes, thank you. So thyroid dysfunction is I think one of the most underdiagnosed diseases, especially here in the United States, and to the female population. So thyroid dysfunction, thyroid hormone is in every cell of the body. And there's 26 patterns of thyroid disease. So unfortunately, the management of running a TSH is not sufficient. And so what happens is oftentimes females, usually because 1 in 3 females are diagnosed with thyroid disease in their lifetime. The most common cause of thyroid disease is hypothyroid, so low thyroid. And the most common cause of hypothyroid is Hashimoto's, which is the autoimmune disease. And so oftentimes women are going to the doctor and they're saying, you know, something's going on. I'm tired. I'm sluggish. My hair's falling out. Have constipation. I'm more emotionally, you know, radical. And they run a TSH. They say, your TSH is fine. Not always do they just run the TSH. They might run other markers, but typically they're not looking at all the patterns. So the female leaves. She says, you know, I know something's going on, because we're in tune with our bodies, right? And they go back 6 months later, the same story. They keep doing this, and then the doctor says, you know, I think maybe you're depressed, maybe you've got this going on, maybe it's too much stress. How about you try this? And so this goes on, and it can be decades before they're diagnosed. Unfortunately, I see that often in my practice, which is sort of where that's my forte, and it's what I love. Because in school, medical school, I was like, wow, I'm not myself. Something's going on. Can't imagine why. Tons of stress, right? And what I realized is I started to have a subclinical thyroid issue. And that's when I started studying functional medicine, which is, you know, I'm so grateful for that. And I was able to help myself, because I too was that patient, you know, that was trying to figure it out and get no answers, and this diagnosis and that diagnosis. And really, I dug my heels in, started studying, and helped myself. I tell my patients, I've probably prevented many diseases in my life, so I'm grateful for my career path, you know, and I'm your guinea pig. I've done everything, tried everything, and anything I'm going to ask you to do, I've done.
Perfect. Now, Dr. Vaughan, how do you go about testing for thyroid hormone or the thyroid stimulating hormone, or TSH?
So first we do blood work, you know, and we do extensive blood labs. So we run the TSH, total T4, total T3, T3, free T3, free T4, T3 uptake, reverse T3, TGBs, and the antibodies for thyroid. And so we run those first. And then when those come back, then we start looking at specialty testing and seeing what's driving, because usually thyroid disease is not a primary disease. It's usually the stressors, the food sensitivities, the infections, the whatever that's driving these diseases or pathways to be downregulated or upregulated. So then we go from, do you have you know, mycotoxins? Do you have mold? Do you have heavy metals? Do you have infections in the gut? Do you have Lyme? Do you have, you know, food sensitivities, obviously, and most people do have all those, or to some degree, at least a few of those.
Wow. There has been a correlation that lately I've heard some research that they're correlating the hypothyroidism and Hashimoto disease to having the fillings, the dark mercury fillings that people used to have.
Yes.
Or it was very common in I guess 15, 20 years ago. So obviously the hypothyroid in females and males are quite different.
Yes.
What do you see? What's the difference between them two? Because everybody thinks it's the same disease, it should act same thing, but it never does.
And which one are you talking about? The difference between
the hypothyroidism between males and females' body?
Oh, it's so funny. I have a lot of theories on why females get more thyroid disease versus males. There's not a lot of research and studies, but I think women are like super women. I don't know a woman that's not handling, you know, their job, their home, their children, their, you know, running the home. And, you know, also running the man's health. Typically, I joke with the men that come in here, and I can tell the difference between a female assessment and a male assessment without a name on it. Because the male's like, nope, I'm fine, I'm fine, I'm fine. And the female's like, oh, I feel this, I feel that. So usually the men in the family are being told, the women are the number one, you know, person that gets the medical going or the wellness in the family. So she's taking care of the man's health, the children's health and everything. So I think that plus, women have babies. So if a woman is not doing prenatal care before pregnancy, that can throw you into an autoimmune disease very quickly, because we all know, having a baby is harsh on the body. Even though it's a beautiful thing, it's also a pretty amazing thing how the body can do that. But there's also, you got to be prepared and to recover from that. Plus, after having the baby, it's a nonstop. Someone told me, once you're a mom, you're always a mom, or once you're a dad, you're always a dad. It never stops, right?
That's right. That's right.
So I think part of that adds to the difference between male and female diagnosis of hypothyroidism.
Okay. And obviously, there are things that they will promote a better thyroid health, and there are things that they actually fight your thyroid hormone and cause issues. Can you give us some pointers of what to avoid and what to basically eat or do more to be helping our thyroid hormone?
Yeah, definitely. And I want to also go back and make sure that everyone understands that when a female walks in my office, I'm saying, first, do you have thyroid disease? They say yes or no. If they don't, I'm like in my head thinking, not yet.
Not yet.
Second, I ask, have you been diagnosed with autoimmune? They say no. And I'm like, not yet. So let's keep you from getting these two if possible. And so I think what I want to take home to, or get everyone to understand, is that hypothyroidism, if you've been given a synthroid, a levothyroxine, been diagnosed with thyroid disease, that more than likely you have autoimmune. And if you haven't been diagnosed yet, that's just yet. And so then leading into your question, I think the most important thing is, eliminating the stressors and figuring out what the root cause of disease is. Are stressors, whether that be, stress from your life, overdoing it. So taking time for yourself, implementing yoga, meditation, just finding some downtime, which I know can be challenging. Number two is the everyday stressors such as food sensitivities. So I think it's very important to have no grains, no sugar, no dairy. And
oh, wow.
I know. And a lot of people say that's impossible. And I say, I've been doing it for 20 something years. So in this world where you can, go shop and get these things, and I teach you how to cook and how to eat and how to live and sustain that lifestyle. There's almond flour, there's, coconut flour, there's all kinds of replacements. However, grains and dairy are inflammatory, and grains also have a mimicry that happens, especially gluten, to the thyroid tissue, and it starts to look like thyroid tissue. So if you have autoimmune, which remember, if you don't yet, then we want to make sure you don't in the future. So it starts to mimic thyroid tissue, and if you're having an attack on the thyroid, then this is upregulating that. So no grains, no sugar, no dairy. Also determining what other root cause. If you've got amalgam fillings, that's one thing. If you've got past mold exposure, leaky gut, gut infections, I see that a lot. So those kinds of things. And I say, if you handle this, then the body can heal itself. And I'm a big proponent on the body is meant to heal. Designed to be healthy. We're the ones that are creating an unhealthy environment because of our lifestyle. So cleaning up the environmental things like the body products, the cleaning products, your everyday stuff is also important as well.
Wow. I mean, I always tell my practice members that our body was meant to heal. Healing is a right. Pain and suffering is optional.
It's true. It's absolutely true.
Now, when it comes to sugar, I've been, preaching it for many, many, many years, but I read a book called Sugar Crush.
Mm-hmm.
And I forget the neurologist's name who wrote this. He's in actually Arizona. He was mentioning that most of the inflammatory diseases known to human have a root in sugar or corn syrup,
Yes,
which is fortified sugar.
I could see that being a huge correlation for sure. And, you know, refined like carbs or break down into sugar as well. So, you
That's
know,
right.
we tend to ingest more sugar than we actually realize. You know, I say the food pyramid should be flipped upside down, right?
Mm,
Um, and it's important to, you know, sugar is upregulates fungus, yeast, parasites, you know, stuff like that, and also cancer. So we want to make sure we stay away from that as much as possible. And I tell my patients it's more on the norm that you're doing no grains, no sugar, no dairy, and rare that you're having those foods. And how to do that is what we work on and specialize here, is how to implement that kind of lifestyle. And also teach our patients the why. Because if I tell you what to do, just like me, if you tell me what to do, I'm probably not going to do it unless I understand why and I study and I have my own experience. And I have. So I think it's important, you know,
it's
that,
amazing that empowering patients and giving them the tool to understand how and why they should do a certain lifestyle change goes a long way.
yeah, it's important. It's important to empower the patients because I want them to be self-sufficient and educated and informative so that they don't get misguided, and also know the basics and understand the why so that they're not fighting with themselves or someone else on what to do and what not to do.
It's amazing. Yesterday I don't watch TV very often, but yesterday it just happened that I was watching TV and it had to do with a health documentary with Dr. Dupka had it, and he was just watching it, and he was in the middle of that documentary. This um advertising came out, and they were advertising this medication to combat opioid crisis and people who are on opioids. And in a bracket, it said, this medication taken with 14 appointments with a therapist did better than placebo, only 12%.
Oh, wow.
So
Yeah.
if you take the medication and go see a therapist for 12 times, it only did 12% better than the placebo,
Yeah. Yeah.
which is mind-boggling.
Right.
Unfortunately, it's to lifestyle changes are a little difficult and hard to stick by. But once you do it and you get rewarded with good health, it's so easy to keep continuing doing because you see the benefits.
Yeah, I agree.
Now,
Most of my patients have gotten to a place where they've tried everything. They've been to different doctors. They've, you know, they almost feel like they're at the end of the rope. You know, they're not getting answers. They're just not themselves. They're fatigued. They can't function, or they're afraid that they're going to die early, like an early death. So they're more motivated than, you know, the person that's just like, I don't feel that great, you know. So they're more motivated to make changes. And then because of their motivation and where they are, they see a bigger shift and change. So that is a positive reinforcement, right? I tell
definitely.
patients the side effect of working with me is probably you're going to lose weight, you know. That's the side effects.
Now, when it comes to women's hormones, I know that you have done some extensive work in there too. Please do give us some information about, you know, progesterone, estrogen, and how it interacts with our diet, lifestyle.
Yeah, so the one thing is when we're going into women or heading into the menopause, you want to make sure that the adrenals are supported and healthy. If you have healthy adrenal system, most of the time, the menopausal cascade is not as terrible. So you want to make sure that your progesterone, your estrogen, your testosterone are healthy and levels out. Oftentimes, women go into menopause, and that means that the testosterone elevates, progesterone goes down, estrogen goes down, all these things. So to support them with natural supplements, I think is the best way to do it. Again, I find working on the root causes of things start to level out the hormones. So from where I stand, given a hormone supplement or given a hormone, I mean, maybe initially supporting the hormones, if they're having hot flashes, let's knock that out. But oftentimes handling the root causes, leveling out the body allows the hormones to be in a natural balance. But sometimes, yes, we need to give supplements, some, estrogen, progesterone, progestate, stuff like that, testosterone. And then sometimes we'll need to write a prescription, obviously, for that as well.
Perfect. Now, when it comes to our immune system, especially this time of the year, for us people up here, that it's quite frigid, not so sunny as it is for you guys down there. What are the things that you recommend to do and refrain from doing? Obviously, you pointed about the sugar and the dairy. What else?
So I have a cold and flu season kind of regimen. I treat sick people often. I joke around the last couple of months and say that I have the cold and flu season supplements are flying off the shelf, right? Because there's probably not been one person that isn't coming in with the sniffles or feeling like they've had it, or a family member. So I think for me, I tend to stay healthy, and that's because I listen to my body, for one. If I feel like I've been treating a lot of sick people, I'll grab some vitamin C and I'll pump that and really overdose it, almost 5,000 milligrams a day, or depending on what I feel like I need to do. I also do, echinacea or different golden seal to help support the immune system. I have great supplements. There's one that just really has been a mover for some of my patients. Their workers, friends have came in like, hey, can I have that supplement? Because they were sick, and within a day they were like better. So I do the regimen with the vitamin C, the golden seal, the echinacea, different immune support, resveratrol, and stuff like that, turmeric. So it's important. Also, make sure that you're sleeping enough and getting enough sleep and listening to the body. If you're feeling tired and run down, that's the body saying, hey, give me some love, take it slow, and I'll be healthy for you. Otherwise, you're going to have to be down and take it slow and sleep more, right?
And obviously, gut health goes a long way, because people may not know, we have more nerve endings and nerves in our guts than our brain and spinal cord combined.
Yes. Yeah.
So obviously, proper gut flora is very essential for wellness and a good immune system to fight whatever comes in. For our guts and GI tract, do you use a specific probiotic, any prebiotic, any sorts of food that you recommend?
Yeah, for gut flora and gut repair and stuff, I actually work on supporting the gut flora while also killing infections, and then doing some glutamine and different supplementation to help repair the gut lining. When I'm working in the gastrointestinal system, I tend to hit it hard because there's typically not a patient that comes in here that does not have gut infections. And also, clinically speaking, I tend to think that, and this might be a shocker, more people have parasites than they actually realize. And I do stool test. I do ask the patients to do test. They come back positive, and also sometimes they don't. But then I give a supplement to handle that, and they get a reaction. And I'm like, sometimes testing is not 100%, right? So yeah, I do a combination of, killing infections, repairing the gut, supporting the flora with good probiotics, prebiotics. It's important to do that. And I think I use different products depending on what it is. I also do muscle testing and seeing what patient resonates with which product.
Perfect. Now, Dr. Vaughan, in all seriousness, I mean, we can go on for hours and hours discussing these matters, but imagine yourself, I don't know how long you have been in practice, but think about the day you graduated from your school.
Oh.
What advice will you give your younger self now?
Wow, that's a great question. I think it's important to be mentors to the ones that are graduating. And, I look at my business, not only am I helping my patients and the community, but I'm also a positive source for my employees, to help their lives, be a support for them, keep them healthy, but also the students graduating, because the thing that we did not learn in school was business. Thank God I had a business degree, and I'm still, it's still hard. Running a business is, it's a whole nother thing. You don't just get to be the doctor, right?
That's right.
And in today's world, it's even more challenging because there's so many mediums that people get distracted.
Mm-hmm.
And so I think finding a mentor, finding out what that is, listening and also finding your way with marketing, or find someone that knows like what marketing and running a business is, because just being the doctor and showing up and having an office doesn't mean that people are going to show or even like you. The other thing is, I say that, and there's a lot of practice managements out there, and you have to be careful. You got to be careful, because sometimes they want to lock you in and it's not a right fit. So if you're not trying to build a structured clinic and you got a structure management clinic or management program, then that doesn't fit. So find someone that actually resonates with you to help guide you. Read all the books you can about business, but really just get out there and do it. And it takes time.
It does.
And lots of mistakes, right? Learn from your mistakes.
To be honest, I try to look at my mistakes as a learning curve.
Of course, yeah.
And I always say difficulties are not on my way. They're not in my way. They're on my way.
It's true.
So I always try to keep, the endpoint in focus, and it just makes it a little easier. Now, Dr. Kristi, what is the routine for Dr. Kristi when she wakes up in the morning? Do you do any meditation? Do you do praying, yoga? What is your routine?
Yes, and I'm evaluating my 2020 life, right? So I just wrote some goals. So hopefully I'm going to get better at this. But at the moment, my routine is I wake up, I, do a gratitude list verbally or in my head. I say my prayers. I, give thanks. I bless other people. I then usually drop and do like 20 push-ups, 3 sets, and get my high intensity interval training in.
Very nice.
Push-ups, jumping jacks, run in place, 3 to 5 minutes, which helps increase my adrenals in the morning, which, I'm a business owner and a doctor, so obviously I need that.
Yes.
Unfortunately, I go back and forth between, a green shake and a coffee. So that's that is my vice sometimes. And January we'll be doing a detox, so I'll be off of that very soon. And then I, as I'm driving, I'm listening to something positive. I listen to, Darren Daly. I don't know if you guys have heard him. But as I'm, getting ready, I'm listening to that. And then I just, again, touch base, meditate when I get to the office. on what my day looks like, what I want to do, how I want to be. 3 to 5 minutes, 5 to 10 minutes, whatever I have, a meditation. And then that's how I start my day. And
Beautiful.
I would love to start it with yoga or end it with yoga. And I'm just found 2 classes through the week that I'm going to implement next year. So that's exciting.
Beautiful, beautiful. As we discussed earlier, wellness is an ongoing endeavor. It's a lifestyle. It's not something you do once and you're done. It's just you got to keep doing it. And even mindset, because mindset is huge when it comes to wellness.
It is.
As you pointed out earlier, when one sees the benefit of what they're doing, it has direct benefit on their body and directly affects their lifestyle, their family, their occupation, and.
It's true. And I do a meditation, and I read some affirmations, kind of prayer every day before I start my day. So I think it's important, setting that affirmative and being positive, because, you never know what the day's going to bring, right?
Positive vibes goes a long way. I'm sure you feel the same way. Sometimes you could be having the worst day ever, and we all have it. We all have this.
Yeah.
But how you manage that stress is what matters at the end of the day.
It's very true. And, I'm trying to realize myself, everything that's supposed to happen will happen.
Mm-hmm.
Right? There's sometimes there's a force that's bigger than me, sometimes, right?
Of course.
All the time. And me trying to control it and get in there sometimes is the problem. Just let the day flow, do the things I'm supposed to, make my top 3 tasks that need to get done. And when I get those things done, everything else is bonus, right?
Yeah, definitely. Now, Dr. Vaughan, I am grateful for your time and dedication for allowing us to have this interview. I know you had to come to the office early just to go with our interview time. Now, please give us address, websites, handles, Facebook. If anyone wants to get a hold of you, how do they do that?
Perfect. Thank you so much. And again, thank you for having me. It's been a pleasure, and blessings to you and your practice and your patients and your family.
Thank you.
So you can, our website is Vaughan, VAUGHAN, vitality.com. Our phone number is 714-434-9355. You can follow us on Facebook, Instagram, Twitter. Well, I don't think we do Twitter as much anymore. LinkedIn. So we have, social media. And then I also have, is it okay to show my book?
Oh, definitely, for sure. Yes, please do.
So, and also we have, I have the book called Thyroid Track, because I had way too many females that were being underdiagnosed for the thyroid disease. So I wrote a little book for patients so that they could read that. Not everyone can physically come see me. Not everyone has that opportunity. So I thought at least that would be a great start. That's what I do with most all my patients. The other thing is we're going to be doing a detox in January. So it'd actually be fun to have you with us. Sorry,
I would love to. I would definitely love to.
I don't know if we're going to do it the 6th or the 12th, but it's like the 2nd or 3rd week in January. Let me see. I think we said the 20th or 13th. We're going to do a whole big group of detoxing, and
I'm game.
All right, that would be awesome to have.
I'm game, definitely. Now, where do our viewers get your book from? If you could please give us the title again and where to get the book, that would be awesome.
So it's titled Thyroid Track, and basically it's how to get your thyroid back on track. And you can get the book on the website at vaughanvitality.com, and you can call the office and we can ship it out to you. And if you want to sign up for the detox, just give us a call. If you have any questions, give us a call. We'll be be glad to do a consult or anything like that if you're interested, and see if you're the right fit or if we're the right fit for you.
Perfect. Dr. Vaughan, thank you again for your time. I certainly appreciate it. hopefully you will come back in another perfect time for you.
Thank you so much for having me. Have a great day and stay
You
warm
too.
out there. Thank you.
Thank you.